Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. Spinal cord stimulator is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. It works well for either chronic back or leg pain. It's considered as a last resort treatment because it does involve surgery. It's very expensive for the insurance companies, and it doesn't fix the problem, but it can mask the pain tremendously well. It's not a first-line treatment, and it does not fix the chronic pain problem. But for those who have failed back or neck surgery syndrome, postlaminectomy syndrome, RSD or CRPS, diabetic or peripheral neuropathy, or esoteric items such as testicular, pelvic, or abdominal pain, it is increasingly being used as a last resort for these conditions. It can take a person with chronic pain, depression, and inability to work and essentially turn a person's life around. Okay? It's been shown to work well for back, neck, arm, and or leg pain. Insurance companies do require a trial placement first, which is a low-risk procedure. It's outpatient. It is an excellent last resort option when surgery is not indicated. All right, so if you've been told that you had surgery, it didn't really work very well, you have no other surgical indications, you're going to basically, your option is for chronic narcotics, this may be the lifesaver, godsend procedure. It can also decrease the need for opiate medications as well. So here's the steps. Trial implant is the first phase. It's percutaneously placed with two tiny leads, and it actually ends up being attached outside the skin. The wires come out with a sterile dressing, and then it goes to an external battery pack / programmer for about 5 to 7 days. It's put in under sedation because you can't be asleep. The pain doctor needs to ask you if the placement of the leads is and when it's turned on, if it's covering the area where you're having pain, either if it's the back or the leg. And then it's worn 5 to 7 days. It's actually taken out in the office. If the pain journal that you keep shows that you're getting over 50% pain relief, then you pass the quote trial, and then you go into a psychological evaluation. Insurance companies require that for giving approval for the final. So how is the final planted? Well, it takes about an hour. It's put in completely under the skin. It consists of a large paddle lead for better coverage. You do have to do a slight incision, and the doctor does remove some bone so that the large paddle leads can go underneath and around the spinal cord. Then the leads are tunneled under the skin to the battery pack / programmer, which are very small now, and that's subcutaneously placed, usually above the buttock area or around the side into the abdominal region. The newest spinal cord stimulator programmers have over 200 programming options, okay? And they're actually rechargeable through the skin, so you don't have to replace the battery pack every few years. The newest ones don't lose coverage as you move from a sitting to a laying position. The older ones did. They didn't know how to handle that changes in movement and position, but the newest ones actually are able to do that. So here's a paddle lead. This is actually what's placed around the spinal cord. So as you can see, it's pretty big. Okay, so you do need to take some bone out to be able to place that properly. And these silicone diodes are really effective at doing all the programming options. So numerous studies have looked at the effectiveness. In one St. Jude study, 84% had life greatly improved with the stimulator. Another study looked at it and showed 77% good to excellent pain relief. Another study looking at diabetic neuropathy showed that 85% experienced substantial sensation recovery, and over 3/4 had significant pain relief. And for RSD, studies have shown that SCS works extremely well for pain relief. So overall, these studies are showing 75 to 85% excellent pain relief with spinal cord stimulators. You can see the battery packs now. They're not that much bigger than a quarter. That's incredible. Okay. So what are the risks? The risks are actually, they're prevalent, but they're not humongous. Okay, the device may stop working. The leads may migrate. Okay, you can get infection, bleeding, wound breakdown. So they're common, but they're not usually, fatal or ridiculously harmful. They're fixable. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state. Over 50 insurances are accepted at the affiliated clinics with over 25 treatment options. The board-certified, award-winning doctors maintain over 90% average success rates. Please visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.